Hello, and welcome to today's webinar titled Healthy Eating and Cancer in Canada, Current Research and Policy Actions. This is the fourth webinar in our Policy Actions to Prevent Cancer webinar series. My name is Benjamin Rempel, and I'm an analyst on the prevention team at the Canadian Partnership Against Cancer. I will be your facilitator for today's session. I'm joined by two wonderful colleagues from the National Collaborating Centre for Methods and Tools based at McMaster University, Maureen Dobbins and Stephanie Hopkins, and we'll introduce each of them in just a few minutes. Next slide, please, Pam. As we begin, we would like to recognize that the partnership's head office is in Toronto on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Today, Toronto is home to many First Nations, Inuit, and Métis, and we are grateful to work and live on this land. A few housekeeping announcements. You may turn on subtitles for this webinar in English or French by selecting the settings button on the bottom of your screen. All attendees will be muted throughout the duration of the webinar, so please write any questions you have through the Q&A panel. And to note, we are recording this webinar, so following this webinar, a recording and the presentation slides will be shared with all attendees. For today's session, I will provide some brief introductory comments, followed by a presentation on research evidence from a recent report the partnership commissioned on healthy eating and cancer prevention. I will then provide a few promising policy interventions we are seeing in Canada, and then we hope to leave ample time for questions and discussion. So over the next hour, we hope to increase your knowledge of the healthy eating and cancer prevention landscape, provide examples of policies that currently exist in Canada, and we'll briefly investigate changes brought on by the COVID-19 pandemic. So to begin, a bit about the Canadian Partnership Against Cancer. The partnership is a federally funded pan-Canadian health organization that works alongside provinces and territories and other partners to promote equitable access to quality cancer care and cancer prevention initiatives. The partnership acts as the steward of the Canadian Strategy for Cancer Control with an aim to accelerate action in this area. Our efforts are focused on the long-term objectives of reducing the incidence of cancer, reducing the likelihood of dying from cancer, and improving the quality of life of those affected by cancer. Priority one of the strategy, as outlined on this slide, decreasing the risk of people getting cancer, is where this work and webinar resides. Feel free to review our website to learn more about the role of the partnership in preventing cancer in Canada. This infographic is from the Canadian Cancer Society's COMPARE study, and it situates the importance of healthy eating in the prevention of cancers in Canada. You can see through this graphic that related factors to healthy eating and cancer include excess weight, low fruit and vegetable consumption, and high red meat and processed meat consumption. Alcohol is also a factor in Canadian diets, but alcohol as a risk factor is detailed out separately in our alcohol policy pack, and we encourage you to review this, which is available on our website. Much of what I'm presenting today is captured within the partnership's recently released web resource on healthy eating and cancer in Canada. This digital resource features key context and statistics and a review of policies across Canada, informed by a rapid review on effective policy interventions related to healthy eating, which was developed by the NCCMT. We invite you to consult this resource to inform your work. Also at this time, I would like to acknowledge and thank the many people involved in the production of this resource, in the research, writing, statistical analysis, graphic design, translation, website production, and publication of this resource. Many hands were involved, and I'd like to take this time to thank those people for producing such a strong resource. Healthy diets can reduce the risk of developing several types of cancer. From our research, we know that healthy diets may reduce the risk of developing esophageal, stomach, lung, pancreatic, and prostate cancers. And we know unhealthy diets, such as those high in sugars, high in saturated and trans fats, or low in fiber foods may increase the risk for endometrial, breast, and colorectal cancers. These are important considerations as we know cancer causes considerable economic and public health pressures on the healthcare system, while impacting individual, social, financial, numerous quality of life measures, and psychosocial factors. There is good news, however. Through effective policies and programs, many of these cancers can be prevented. Through the partnership's OncoSim program, it is estimated that if the reductions outlined on this slide can be reached by 2029, then we can prevent those corresponding numbers of cancers per risk factor by year 2042. So, for example, if we can just go back, sorry, Pam. For example, if daily red meat consumption was reduced by 1 serving by 2029, then 860 cancer cases could be prevented by year 2042. Okay, now we'll go to the next one. So we'll pause here just for a moment to see who has been paying attention. So please review the question on the slide. You can either enter your answer in the Q&A panel if you wish, A, B, C, D, E, or F, or you can just think of the answer to yourself. You can jot it down if you'd like to yourself, whatever you're comfortable with. So the question is, which cancers are related to healthy eating? And the options there, A through F, are esophageal, stomach, lung, pancreatic, prostate, or all of the above. So I'll give you 5 seconds to think about this. Wish we had Jeopardy music, but we don't. So I think that's 5 seconds. So the correct answer is F. We know from our research that healthy diets consisting of adequate fruit and vegetable consumption reduce the risk of developing esophageal, stomach, lung, pancreatic, and prostate cancers. So congratulations to those who chose the correct answer. So we'll go to the next slide. So I would now like to introduce our speakers who will present on research evidence related to healthy eating and cancer. So Dr. Maureen Dobbins is the Scientific Director of the National Collaborating Center for Methods and Tools, which provides leadership and expertise to guide research evidence into policy and practice. Dr. Dobbins also serves as a professor in the School of Nursing at McMaster University and as Director of Health Evidence, a single source tool of high quality evidence for public health professionals. Her research efforts seek to understand knowledge translation among public health decision makers in Canada. Stephanie Hopkins' background is in public health care delivery in the field of gerontology. After completing her Master of Public Health at McMaster University, she joined the NCCMT as the Business Development Analyst, regularly contributing to the Rapid Evidence team, which synthesizes research evidence to support the public health sector. So I want to welcome both our speakers, and I'll now turn the presentation over to Stephanie. Thank you.
Great. Hi, everyone. First of all, thank you to Ben and the whole CPAC team for putting this webinar together and for inviting us to present these research findings. As Ben mentioned, my name is Stephanie Hopkins, and Dr. Dobbins and I are joining today from our home base at McMaster University, located on the traditional territories of the Mississauga and the Haudenosaunee Nations, and within the Dish with One Spoon Wampum Agreement. The wampum uses the symbolism of the dish to represent the territory, and the spoon to represent the people who are to share the resources of the land and take only what they need. Next slide, please. The National Collaborating Center for Methods and Tools is one of 6 NCCs, National Collaborating Centers, located across Canada. In British Columbia, we have the NCC for Indigenous Health in Prince George, the NCC for Environmental Health in Vancouver, we have the NCC for Infectious Disease in Winnipeg, Manitoba, the NCC for Healthy Public Policy in Montreal, Quebec, and the NCC for the Determinants of Health in Antigonish, Nova Scotia. The NCCs were established in 2005 post-SARS and are funded by the Public Health Agency of Canada. We at the NCCMT encourage and scale evidence-informed decision-making and provide high-quality resources, real-world training, and practical mentorship for those in public health and beyond. Next slide, please. The primary objective of this review was to identify effective policy and program initiatives to increase healthy eating and/or decrease unhealthy eating for cancer prevention. Our secondary objectives were to identify evidence for cost effectiveness or cost savings associated with successful implementation or effective interventions. And we also set out to identify any differential impacts of interventions among diverse populations. Next slide, please. Our search strategy was to search health evidence for systematic reviews published between January 1st, 2012 and May 31st, 2022. Based on the amount of available literature, we limited the search to only those systematic reviews that were appraised as being high quality. Health evidence, as by background, is a registry of over 8,500 quality-rated systematic reviews evaluating the effectiveness and cost-effectiveness of public health intervention. Each systematic review undergoes a quality appraisal by 2 independent raters using the Health Evidence Quality Assessment tool, and any conflicts are resolved through discussion. The outcomes of this review were appraised using the GRADE systematic approach to rating the certainty of evidence. Next slide, please. Once our search was completed, we organized our search results according to the NOURISHING Framework. The NOURISHING Framework was developed by the World Cancer Research Fund International and is widely used for policy evidence. Our results were limited to the policies and program initiatives in the food environment and the food system, so the NOURISH portion of the framework. Next slide, please. After we completed our full text screening, we identified 30 high-quality systematic reviews. These reviews included narrative reviews and meta-analyses published between 2017 and 2022. We will be presenting select findings from these studies. And to start, we begin with interventions to increase healthy eating. 24 reviews reported results for these outcomes. Next slide, please. First, we present the findings from the food labeling domain, which was found to have a large effect on increasing healthy eating. Overall, our review found evidence to support the use of all types of food labeling in comparison to no labeling. However, front of package labeling was found to have a 2-fold higher odds of selecting a healthier food option than other labeling types. So more specifically, food labeling interventions reported a statistically significant increase in the consumption of vegetables. Next slide, please. Next, we report on the findings from the food provision domain. So those are those initiatives implemented in school-based settings, which we found to be the most promising given the emphasis on children and establishing healthy nutrition habits in youth. First, we found that direct food provision interventions, so providing fruits and vegetables in schools, resulted in a moderate increase in healthy eating, specifically fruit and vegetable consumption. Secondly, and most promising, was the finding that provision of universal school meals resulted in increased food security by a large amount. So kids who attended schools with universal school meals were 2.85 times more likely to be food secure than kids who attended schools with either no meal program or limited meals. Next slide, please. Also in schools, under food provision is increased school meal standards. These were shown to have a large effect in increasing healthy eating through increased consumption of fruits, vegetables, and water consumption. Next slide, please. Our review also found that food pricing interventions via subsidy increased consumption of fruits, vegetables, healthy snacks, and beverages. This included results from a large meta-analysis reporting a statistically significant finding that for every 10% decrease in the price of healthy food via a subsidy, consumption of these foods increased by 12%. Further subgroup analysis on the type of healthy food revealed that for every 10% reduction in the price via subsidy, fruit and vegetable consumption increased by 14% and other healthy food consumption increased by 16%. Next slide, please. Next, we present findings from interventions to reduce unhealthy eating, and these were captured in the same 3 domains as healthy eating. And here we present the findings from the 27 reviews reporting results to decrease unhealthy eating. Again, front of package labeling was found to be effective. In terms of reducing unhealthy eating, it was effective in reducing consumption of calories, consumption of trans fatty acid or TFAs, and saturated fats. Next slide, please. Restaurants using nutrition labels on menus as a standalone intervention had a moderate to large effect on reducing unhealthy eating, with a reported statistically significant reduction in energy purchase. So here we have about a mean difference of about 50 kilocalories. This effect was greater when additional context or interpretive information was included on the label, as we see here in the second example. And there we saw a mean difference of about 81 kilocalories in energy purchased. Next slide, please. Next slide. Food labeling was also effective in reducing both sales and the consumption of sugar-sweetened beverages, so also called SSBs, by a moderate to large amount. So for example, traffic light type nutrient labels were found to reduce the odds of selecting an SSB, a sugar-sweetened beverage, by half. Further analysis showed that when labels communicating a health effect were used, as you see in that second example, the odds further decreased by about 2/3. Next slide, please. Our next set of results decrease unhealthy eating outcomes from food provision interventions in school-based settings. So here we have, again, direct food provision interventions, so fruits and vegetables provided in schools, was shown to reduce unhealthy eating, measured as a consumption of unhealthy snacks and SSBs, by a small to moderate amount. Next slide, please. So similarly, improving school meal standards reduced unhealthy eating, measured as energy from fats, saturated fats, and SSBs, by a small amount. And finally, within the food provision domain, limiting food competition items within school settings results were in line with results from increased meal standards and food provision in reducing unhealthy eating by a small amount. Next slide, please. Great. Food pricing interventions via tax reduced unhealthy eating as measured by the consumption of sugar-sweetened beverages. Similarly to subsidies, taxation had a representative effect on SSB consumption and sales. So for every increase of 10% via tax, consumption decreased by 6%. Subgroup analysis indicated that for every 10% price increase, fast food consumption decreased 3%, whereas SSB sales decreased by 7%. Next slide, please. Our review also found strong evidence for other interventions that we wanted to draw your attention to. So these were multi-component interventions involving some combination of any of the two listed here. There was strong evidence for direct provision of fruits and vegetables in workplaces, farmers markets, in-store choice architecture, and local municipal incentives to increase healthy eating. Alternatively, there was strong evidence to support the use of healthier default retail menu items for children and federal government incentives to reduce unhealthy eating. Next slide. Our review also includes strong evidence that some interventions did not work. Specifically, we found evidence that front-of-package traffic light labeling for sugar-sweetened beverages sold in vending machines had no effect. Next slide. And finally, there was limited evidence to support the use of farmers markets in low-income areas and/or mass media campaigns to increase healthy eating. And there was limited evidence to support planning restrictions in urban and remote communities to decrease unhealthy eating. Next slide. So limitations and implications. A note of caution in terms of the certainty of evidence. This review represents the best available evidence. By their nature, population level policy interventions are inherently have a high risk of bias, making the certainty of evidence low to very low. However, this should not be a barrier or stop policymakers from acting, and as such, policymakers should balance the certainty of this evidence with additional factors. So in relation to nutrition and cancer, the expected harms of not acting related to the morbidity and mortality from cancer is high and will exacerbate health inequities. We also highlight some methodological limitations of this review. Our search was very comprehensive, but not exhaustive, and it is unlikely that additional studies would significantly change the results of the current review. Our search was limited to English, and this may have overestimated the true effect size. Alternatively, our search was limited to high-income countries. However, it is unlikely that interventions from low to middle-income countries would be generalizable to the audience of this review. Next slide, please. So next steps. So now what? This review highlighted a suite of policy type interventions that could be implemented to increase healthy eating and reduce unhealthy eating, which in turn may reduce population cancer levels. In terms of the research, evidence on differential impacts for diverse population is very limited and is very much needed. In a few studies, there were gender-based data, but they lack sufficient context to make any meaningful conversations. Additionally, our review did not find any information as to the cost effectiveness of any of these interventions. And although none of the included syntheses reported on the impacts of the COVID-19 pandemic on healthy eating in general, emerging Canadian population level data on the effects of the pandemic reported that Canadians increased their consumption of unhealthy eating, defined as junk food and sweets consumption, by 27% at the onset of the pandemic. And at 1 month follow-up, this had increased to 35%. And this is according to Statistics Canada. These effects were higher for adults living with children than those adults living without children, suggesting that further research will be needed to understand if the increase in healthy eating and unhealthy eating was sustained throughout the course of the pandemic and how this may have a lasting impact on households with children. This also emphasizes that we will need to reprioritize the knowledge and the perception of the relationship between nutrition and cancer as we emerge from the COVID-19 pandemic. Next slide, please. So as you reflect on the presentation and the evidence that we've reported on, we'd like everyone to consider to what degree you would agree or disagree with the statement that government policy interventions to increase healthy eating or reduce unhealthy eating should be a priority as we emerge from the COVID-19 pandemic. And really think about where you fall on the scale. So 1 being you strongly disagree with the statement, or 7 that you strongly agree with the statement. Next slide, please. So thank you for having us. We would like to acknowledge the ongoing work of the NCCMT's Rapid Evidence Service team who make all of this work possible, especially those who contributed to the development of this review. And with that, Ben, I will hand it back to you.
That's great. Thank you very much, Stephanie. I'm going to spend the next few minutes providing a high-level overview of the healthy eating policies environment in Canada based on our analysis. And then we will get to your questions. There's a few queued up in the Q&A board, which is great. Thank you for asking those. And once we get to the Q&A section, I'll publish those questions and then we'll have time to go through those. So on this slide here, to begin, when we say healthy eating policies, this is typically interpreted as legislation, regulations, guidelines, provincial and territorial policies, bylaws, municipal plans. These are some examples of what is meant by that term. And also healthy eating policies, they rarely live on their own. They are often embedded within other existing broader plans. So you have to sometimes dig within these other plans I just mentioned, such as bylaws or municipal plans, to find regulations related to healthy eating or nutrition. A second comment here is, through our research, we concluded that food environment policies such as food provision in schools, food labeling initiatives, food reformulation, and restrictive food retail policies were effective in increasing healthy eating and decreasing unhealthy eating. And lastly, an important comment that through our scan, we concluded there is a noticeable gap on policies that address health inequities to better nutrition outcomes. We know that different policy approaches are needed across different settings and different populations, and this work should be guided by a health equity approach. Great, so next slide, please. So what did we find? So you can see from the chart here that a medium to strong policy emphasis was found in the areas of food provision and food pricing across provincial, territorial, and local jurisdictions. Less emphasis is focused on food composition, retail, promotion, and labeling, and this provides an opportunity to strengthen policy measures in these areas. I should stress too that this exercise to arrive at the ratings of low, medium, and high was a subjective exercise. So 2 analysts independently reviewed Canadian healthy eating policies to then provide a label of emphasis to help illustrate the current policy landscape. So next slide. So the first policy domain we're going to look at is food prices. So Stephanie presented the research underneath these policy domains, and these are the policies that currently exist in Canada and what kind of conclusions we can draw from that. So the degree of policy adoption for provinces, territories, and municipalities as it relates to food prices was on the previous slide rated as medium. Most provinces and territories have policies related to food prices, including a nationwide tax exemption for certain groceries and prepared food items. However, we did not find any policies that regulate food prices specific to cancer prevention. A few municipalities have outlined policies to make healthy food more accessible and affordable, and several communities have outlined plans to increase food security. To increase healthy eating in this area, there are some opportunities for action, and these policy directions could include expanding tax policies on unhealthy food and beverages to encourage healthier diet choices, noting that tax policies must include equity considerations for low-income populations and those experiencing food insecurity. Secondly, an opportunity includes implementing additional policies that govern food prices, including those that subsidize healthy food options, as they can make healthy eating options more accessible. So the second domain we looked at was food provision. The degree of policy adoption for provinces, territories, and municipalities in this policy domain was rated as high. All provinces and territories have at least one policy on healthy eating and food provision. Most provinces and territories have adopted a similar approach to food provision policies, and most of these cite Canada's Food Guide as a benchmark for healthy food options. The most consistent food provision policies govern schools and childcare centers. At a municipal level, many encourage healthy eating through food provision. These policies range from providing healthy food options in municipal buildings to ensuring residents have access to locally grown produce. And again, on this slide, there's opportunities for action, which we focused on. So future policies that place a greater emphasis on individual or cultural preferences and practices, rather than adopting a blanket approach to healthy eating, would be advantageous. And secondly, consultation on the national school food policy and a national school nutritious meal program is also encouraged. Okay, so the degree of policy adoption for food retail was rated as low for provinces and territories and medium for municipalities. So at the provincial and territorial level, other than policies regulating food sales in schools, very few have enacted policies regulating food retail. But many local government policies that were reviewed have planning policies, such as official plans, land use policies, or zoning bylaws that provide direction about where food retail and service outlets can be located. Future policy directions should improve access to healthy food in a variety of settings, and some of these policy options could include improving access to healthy food in retail settings or restaurants, and regulating unhealthy food retail in settings like recreational or healthcare facilities. Okay, our next domain that we looked at was food promotion. The degree of policy adoption was rated as medium for provinces and territories and low for municipalities. Most provinces and territories have policies governing food promotion, whereas few municipal policies were found to promote healthy eating through educational or marketing campaigns or implement regulations against what is termed junk food marketing. Stricter policies that restrict this junk food advertisement and encourage impressionable populations to eat healthy are encouraged. Enacting region-specific food promotion policies could encourage healthy eating while considering varying demographics that may not be captured within broad provincial, territorial, or federal policies. It is also encouraged to continue to support the federal government's commitment to restrict the commercial marketing of food and beverages to children. The degree of policy option for provinces, territories, and municipalities for the policy domain of food composition was rated as low. No or very few policies were found to target food composition at the manufacturer or retail level. This is expected as food composition regulations generally fall under federal jurisdiction. So we weren't necessarily surprised with this finding. However, still things for opportunities for action are policies that restrict foods that are high in sodium or sugar in community centers and settings are an area for continued action. Next slide. Okay, great. And finally, the degree of policy option for provinces, territories, and municipalities in relation to food labeling was rated as low. Despite several policies which govern food labeling as it relates to food safety and manufacturing practices, very few provinces, territories, or municipalities have adopted food labeling policies for healthy eating, with only one example requiring restaurants with multiple locations to list caloric information on menus. But similar to the previous domain, this finding is somewhat to be expected as food labeling actions are generally influenced federally. Still, policies at different levels could be implemented to increase knowledge and inform healthy food choices. Some policy directions to be considered include mandate labels to disclose the amount of added sugar or fat, identify healthy menu options based on fat, sugar, and sodium content, and support federal regulations requiring front of package labeling systems. Okay, great. So here we have our last poll of the webinar. And this is just before we move into the discussion period. So the question is, how is food retail as a policy action defined? A, B, C, or D. So again, you can feel free to type an answer in the Q&A feature, or just think about it on your own. You can jot it down if you'd like. So I'll give you 5 seconds just to review this slide. Okay, so that's your 5 seconds. So the correct answer is B, government intervention to support the availability of healthy foods and limit availability of unhealthy foods. So that's how we are defining that policy action throughout this work. Okay, next slide. Okay, so thanks very much for your attention. We're going to move into the Q&A section and discussion period. So we have a few questions already in the Q&A. You likely can't see those yet. We control publishing them, so when we're about to answer them, we will publish them so you can see what we're answering. So feel free to continue to post the questions in the Q&A panel. We get them, to be sure, and we will publish those. We're hoping to get to as many as we can. We also asked on the registration form if there were any questions for the presenters at that time as well. So we received a lot of questions through that forum as well. So I will be going back and forth between the questions we received ahead of time and the questions that we are receiving through the webinar platform here. Okay, great. So we will start here. If we're able to bring up Maureen and Stephanie, and they can come off mute, that would be great. Stephanie, the first question is for you, and it's I'll start you easy. It's a very easy one. Is the rapid review available publicly?
Yes, the rapid review is available publicly. I believe that Pam is going to put the link in the chat box. It is available on our site. I believe it is also linked through your Healthy Policy Pack as well. Okay,
great. Yes. She will post it on the Q&A feature, just so not everyone's getting confused as I do between the chat and Q&A. So you should be seeing that question now in the Q&A. And Pam, you wave me down if this is not working, and we will post the link to that. But as Stephanie said, you can access it a variety of ways through NCCMT's website and also CPAC's policy pack. We on the summary page, which is our homepage of this policy pack, we link directly to that report. Okay, great. So the next two questions, Stephanie and Maureen, if you can talk through this about around food security.
Mm.
So the first one was, how was food security measured in the example for school meals? I believe this was on slide 20 when you were talking about that concept. And then similarly, just can you clarify the key messaging on the connection between food programs and food security? Kind of what are the main messages we are to draw from that? So again, I'll start publishing these, but the first one was, how is food security measured in the example for school meals? I think they are referencing slide 20.
In the context of those two reviews, food security was measured as a dichotomous measure. So it was either food secure or food insecure. So just to clarify, there was no varying degree of food security found there. They were measurements from schools from the United States. And in terms of what measurement used to measure food security, other than are food secure or insecure, I'm not aware what additional measures were.
Okay, great. And then just around, just kind of clarify the key messaging on connection between universal food programs and food security.
Yeah, so first I just want to clarify there that universal school meals, so that meant all kids in school were given meals. So not just kids who were eligible for benefits based on like SNAP benefits or based on any sort of measure of socioeconomic status. This was a measure of all kids receiving universal school meals in school. So the big takeaway there is that not only did universal school meals increase food security for all kids, but the other takeaway there was the review highlighted that schools also increased food nutrition standards. So kids were getting better quality meals and they were getting more meals. So those were the two big takeaways from that. So increased food security and increased food nutrition based on school meals.
Okay, great. And then I think you just answered this, but I'll ask it just in case we can be more clear on it. How is food security, the term food security, measured in the example for school meals?
It was a dichotomous measure: is food secure, is not food secure. It was a self-report of family food security.
Okay, great. Thanks so much. Yeah,
Ben,
please go ahead. Yeah.
It's Maureen. I might just jump in there. So I took the liberty of while you were speaking to just go back to our review and look up the evidence in our review about this. So we're specifically talking about one meta-analysis that was conducted in 2021 that included 46 studies. Some were randomized controlled trials, others were quasi-randomized, with a total sample of over 700,000 students. And their overall effect size, as Stephanie pointed out, was just under 3 times the odds of being food secure for those students in those schools receiving the universal program compared to those who weren't, with the confidence interval ranging from about just under 1 3/4 to just shy of 5%. So they're really quite compelling, but I think, as Steph pointed out, these are all studies that were conducted in the US of American populations.
Okay, great. Thanks so much, Maureen. There is a comment here too, and I think you've touched on it a little bit, but the comment is that the claim that a student nutrition program would reduce food insecurity is surprising. There is some research from Proof, an organization called Proof, where I guess their conclusions are different. Why do you think there is significant difference between those conclusions? Not sure if you're familiar with that research. If not, you may not be able to answer it, but.
Yeah, I'm actually very aware of Proof. I was referencing them in some additional background information. I think in the context of the proof study, I believe that what they're saying is that income support is the key, and I don't disagree with their conclusion. But in the context of this review and the evidence that this review found, it was showing that universal school meals were effective in increasing food security. That being said, if we extrapolate that to the larger population, we're looking at unmet income needs that would support food security. I don't necessarily think that the two are at odds with one another. I think that they're probably two sides of the same piece.
Okay, that's great context. Thanks for sharing that. Okay, great. Well, moving right along, this is going terrific. Okay, so did your review explore the potential negative unintended consequences of these strategies? So many of them seem to reinforce or may reinforce weight bias and unhealthy relationships with food that could lead to disordered eating.
That's a really great question. That was actually outside the context of this review. We did not look at weight outcomes as an outcome measure. I think what you're referring to is I referenced one finding where it was kilocalories consumed. The unintended consequences in these reviews were not reported on, so I can't speak to that. But in the sense, in terms of reinforcing relationships with food, beyond the scope of what we were looking for here.
Okay, terrific. Thanks very much. The next question is around marketing, the food promotion domain. So can you tell us more about mass media marketing campaigns as a non-effective intervention to increase healthy eating? Was it rated as such or concluded as such as this is does have a direct, is it because it does have a direct effect on people's behavior?
I would say yes. In the context of this review, we only found 2 reviews that reported outcomes for mass media campaigns, and they were both in salt reductions. One review did look at a few other reductions in terms of unhealthy eating and SSBs, but they were largely concentrated in salt reduction and found to be fairly ineffective. A, yes, because it's a behavior change. And B, I do remember specifically the study authors concluded that people were not aware of how much salt they were actually taking in. So as with a lot of self-report, people weren't exactly sure what the baseline of their own salt intake was.
Okay, great. Sorry, anything to add, Maureen?
No,
Okay,
that's good.
Sorry, I thought you were motioning to speak, so misread that one. Okay, no problem. Okay, great. Well, keep the questions coming. We've answered all the ones in rapid fire format that have come in, but please feel free to post new ones. We're going to go to some of the questions we received ahead of time through the registration form. So the first question is again on food security, a very important issue. I'm glad these questions are coming up. What role can schools play to improve food security for families with school-age children? Does the research provide examples of interventions for schools?
Yeah, this is a great question. And this is something in our review that particularly jumped out at us as being so promising because the policy was, as we talked earlier, was for all kids to receive school meals. So not just kids who qualified due to SES or any qualifying factor. And it put all kids on equal footing. The results here show that in schools where the kids received the meals, the uptake of meals was higher, and the feedback from the participants that this was because there was no element of stigma attached to receiving school meals when it was everyone. We've touched on this in an earlier question, but the review also highlighted that schools that had increased food nutrition standards, so higher nutrition in foods that the schools were offering or providing for kids, was effective at increasing healthy eating as well. So I think here the important takeaway is that if kids are eating 1 to 2 meals at school per day, that's a significant opportunity to not only provide nutritious meals, but also to instill those healthy eating habits while they're young. You mentioned for families. Well, for families, I think this is significant because it not only increases food security, but it also can alleviate some of the financial pressures of providing daily food, especially as food prices are increasing. It can also alleviate some of the mental health implications of worrying about having to provide adequate and nutritious food for their kids. Maybe perhaps somewhat outside the scope of this review, but one of our colleagues here at the NCCMT, Emily Clark, she completed a systematic review on the structural interventions that affect racial inequalities and their impact on population health outcomes. And they identified changes to the US National Lunch Program that included more fruits and vegetables, restricted grains, and sugar-sweetened beverages, and it increased the availability of non-fat milk. And these changes were shown to be effective in increasing specifically Black students' fruit and vegetable intake. So the evidence is here for schools as an intervention point for increasing food security and increasing nutrition for kids with a positive impact for family units.
Great. Thanks so much, Stephanie. Next question from the registration form process is what should be government's, and I guess that's different levels of government. I would perceive that as municipal or provincial or what have you. What should government's initial steps in ensuring healthy eating practices and policies as we emerge from the COVID-19 pandemic?
In our research, we highlighted findings from a recent World Bank COVID-19 crisis response report, and it suggested that the pandemic had reversed 2 decades of improved food and nutrition security globally, with children being particularly vulnerable. So from this standpoint, the initial step should be to understand the needs of the vulnerable populations, which we noted as a gap in our research, as there is a lack of information on different contexts and different populations, and B, to co-create solutions based on the needs of these populations. And to take this one step further, I'm drawing on conclusions from a review that our team completed on food security during the pandemic. And the findings were to strongly support economic safety nets. So adequate financial support, particularly received by families, significantly improved food security among those who previously identified as food insecure. So from that perspective, I think that the evidence is showing us that financial support is a key strategy, if not the key strategy, in addressing food security and ensuring healthy eating practices and policies amongst kids and families.
Okay, great, fascinating. Thanks so much for that answer. A similar question, it's along the lines of kind of government support, government efforts. And I think you've touched on this already, but I'll just ask the question in case you have a more targeted answer. What is your advice to mobilize the government efforts to focus on equity in regards to healthy eating?
So again, a little bit outside the scope of this review, but we are in the business of evidence-based decision making, so we can point to initiatives that work. And as such, we would urge governments to use equity support tools to identify how programs or policies might impact population groups in different ways, and to make it a priority to address the needs of those most vulnerable first and foremost. And I think to take that one step further, a more effective program would direct resources first to those most in need, and then secondly, direct more resources than what other groups may need based on the potential health equity impacts.
Okay, great. Thanks so much. We're going to move back to some of the other questions that are coming in. So thank you. Please feel free to continue asking those. Did your review find anything related to encouraging traditional or cultural foods, e.g. First Nations, Inuit, and Métis populations or non-Western populations as it relates to healthy eating?
Unfortunately, our review did not find any findings to such, which was disappointing. Not exactly surprising, but disappointing to say the least.
Okay, thank you. So more research in that area obviously is needed.
Yeah.
There's also...
And, sorry, could I?
Yes.
Sorry, can I interject? And I think I might just add as well, that some amount of these findings are impacted by what has been included in the syntheses that we looked at. And so it could be that there is evidence that addresses this question, but for a certain reason, maybe it's study design, for example, have been left excluded from some of the reviews that have been done. So I think that is definitely an important question, and one that we will take with us from this webinar to, I think, to be looking at in terms of, you know, the limitations of syntheses. Because I am aware of there being some literature related to that, and why that is not included in some of these reviews is a good question to be asking.
Okay, great. Thanks so much, Maureen, for that added context. There is another, not a question, but a comment back to the proof study that you referenced before, Stephanie. So the I don't know if you can add comment to it, but the comment I think the proof study refers to household food income versus the study refers to school food security perceived by the student at school. Not sure if that is making sense, but if you had any comment to that.
No, but that would make sense. I can speak to the study findings of the included review, and it was self-reported food security. But I don't think I'm familiar enough with proof to say if that's the difference there. But thank you for pointing that out.
Okay, great. So thanks very much. Keep the questions coming. We're going to go back to some of the ones that we received ahead of time. So Maureen or Stephanie, the question is there any research specifically linking food security, income and income supports, and or transportation options? I read this as kind of like accessibility to public transit to living with cancer or chronic disease.
So here I would actually refer back to the proof results again. So it's a large body of evidence specific to Canada that came out of the CIHR programmatic grant to tackle health and health equity. And it's led by Dr. Valerie Tasasuk at U of T. And it was looking at specifically the implications of food insecurity for health and health care. And their research identifies adults living in food insecurity as being more vulnerable to chronic health conditions and more likely to have multiple chronic conditions, including declining mental health. And their research also showed the differentiation between those who are food insecure and death from non-communicable diseases, including cancer. And they even go so far as to highlight to what degree folks who are experiencing food insecurity have to forgo essentials such as their medications to treat chronic medication or chronic diseases. So not only was the research linking food insecurity to chronic health conditions, but also impacting how people are treating or managing their conditions. And maybe someone can pop this in the Q&A, but the work can be found at proof.utoronto.ca. And I do think that one of the attendees had posted the link there, but that body of evidence can be found at that website.
Okay, great. Thanks so much. Yes, you are correct. There's a U of Toronto link in the Q&A board, so feel free to click on that. And we've also published a link directly to the rapid review that Stephanie's referring to through NCCMT as well in that board. So you should have that information now. Okay, next question. Are there any research grants that you're aware of available to study healthy eating further, including among different population, including those experiencing homelessness, those in rural communities, or those with families or elders aging in place?
Yeah, so there's quite a few available, actually. One of the larger grants available to researchers looking to study healthy eating further is the Healthy Canadians Healthy Communities Fund. That's funded through the Public Health Agency of Canada, so through FAC. There's also the Nutrition North Canada. That is a food security research grant to support Indigenous-led projects addressing food security and food access inequality in communities eligible under the Nutrition North Canada program. In terms of aging in place, there's the Aging in Place Challenge program, which is through the NRC, so the National Research Council. And then there's some smaller NGO grants available through like the Dairy Farmers of Canada Nutrition Research Funding Program, and there's a few food manufacturing specific grants. So lots of opportunities for researchers, and especially as we begin to focus on life after the pandemic. I'm thinking specifically of the Healthy Canadians, Healthy Communities Fund.
Great, terrific. Thanks so much. Okay, another just comment on Proof. Proof's getting a lot of airtime here. Are they our co-sponsor for today? Okay, so it's I think it's just a comment around the use of data. They use a standardized tool, and there might be different definitions of how household food income is being defined, and so that might lead to different conclusions. But I've published the comment. Did you want to speak briefly to that, Stephanie?
I think just thank you very much for highlighting that. And I think that that's important for the audience to understand that, yes, these are likely defined differently and used in different measurement quality. But thank you so much to the person who pointed that out.
Yeah, and the link is there in the Q&A board. So we are coming to the end. I think we're going to have one more question, and then we'll start to close off, as we have about 3 minutes left. So the question is, in the presentation, Stephanie, local municipal incentives was mentioned. Can you give examples of these?
I'd actually have to look back specifically to the review. I'm incentives. I'm not off the top of my head. I'm sorry. No, I can't think of them.
Okay, no problem. Again, the review, you can access that yourself through the link here, and there are examples of municipal incentives in the report. So feel free to reference that. Okay, well, thanks very much. I think that's going to close our Q&A section. So if we can just go to the next slide there, Pam. Yeah, so we have 2 minutes left here. So this is going to conclude our webinar for today. We want to thank the presenters, Maureen and Stephanie, for sharing their expertise in this area. And thank you also to the participants for your engagement and great questions on this broad, complex, yet very important topic. We encourage you to complete the evaluation form, which will be sent to you over the next day or two to help inform future programming. So with that, we thank you very much for attending. Take care and have a good day.